Hello and welcome to my collaboration and leadership reflective video. I'm Shelley Harris, and in this video I'm going to tackle the following topics. Describe my previous interactions with multidisciplinary teams, emphasizing their successes and failures in attaining the project's goals. Observe how lack of collaboration may lead to inadequate oversight of resources and employees. Use the available research to find the most effective ways to improve a multidisciplinary group's efficiency. Select an interpersonal cooperation plan that could assist the team in achieving its goals and collaborating more successfully. And scholarly papers based on facts back up my arguments. My experience. Transition is unavoidable in the medical industry, given the requirement to deliver excellent treatment while meeting the growing medical care demand. Integrating technology improvements by remodeling current healthcare systems represents one of the most fundamental techniques for improving healthcare services. Before implementing electronic health records, the organization I worked for as a nurse manager, Hopewell Hospital, previously used paper-based medical records to document patient information. Paper records were the primary method of storing and organizing patient health information, including medical history, diagnoses, medications, test results, and the other clinical data in our organization. This method of record keeping was time-consuming, prone to errors, and challenging to share between different healthcare providers. With the rise in errors and the low productivity, Hopewell Hospital management agreed to implement the EHR system to mitigate these issues. The administration invested finances and human resources for the success of the project. EHR systems have been linked to lower medical mistakes, expenses, and patient wait times before obtaining help, offering a more efficient method for achieving client data and enhancing access to client information and productivity. Therefore, Hopewell Hospital initiated the process by selecting various staff from different departments, including the nurse manager, EHR implementation manager, head of the billing department, doctors, IT managers, and EHR trainers. The implementation was successful, but the hospital started experiencing patient health information leakages. The latest case involved a prominent actress celebrity, which brought the hospital to the limelight as it violated HIPAA regulations on the privacy of patient information. The rule necessitates proper defenses to secure the confidentiality of personnel medical information and establishes restrictions and guidelines on the application and dissemination of this data that could be done without a person's consent. The hospital convened an urgent meeting to address the issue, and it was discovered that for unethical motives thought to be personal gain, someone from within the interpersonal team environment accessed EHR and disclosed the actress's confidential data online. This led to HIPAA taking legal action against the hospital and imposing a hefty fine on our hospital. As a nurse leader, I was responsible for developing a response plan to develop a report concerning the incident. I assembled our multidisciplinary team to identify the problem's possible root cause and other loopholes in the EHR system. According to the findings, medical personnel failed to be cautious about safeguarding patient information, shutting off or concealing the information system from unauthorized individuals, and swapping information, compromising sensitive client data. I generated ideas for how the difficulties may be avoided in the coming years and how multidisciplinary groups could collaborate more successfully. Formal and informal conversation with workers to gather opinions on possible remedies could assist the administration. I recommended for access in our systems. The most prominent strategy for implementing a proactive method of combating authorization risk is access control. Everyone on the team must be willing to collect and exchange their results with the rest of the collaborators to collaborate. To jointly study, determine, and resolve a specific patient case, team members need to have an equivalent understanding of the actual scenario. How poor collaboration can result in inefficient management of human and financial resources. In medical care, an excellent collaborative effort leverages shared expertise. Staff members can combine, modify, incorporate, and employ outsourced information to achieve an objective or find a solution. In addition to minimizing expenses, unpredictability, dissatisfaction, and concerns, Effective multidisciplinary cooperation enhances workplace fulfillment and employee participation and eventually improves customer satisfaction. Productive interdisciplinary cooperation is viewed as a supplementary strategy for improving team dynamics. Multidisciplinary teamwork undermines patients as well as healthcare workers. The patient outcome reflects the level of teamwork in the healthcare business. Dissatisfaction, medical mishaps, shortage of resources, a perception of inadequacy, and reduced output characterize poor working relationships and cooperation. In such a situation, a corporation is likely to spend its monetary resources unnecessarily and its human resources ineffectively, exacerbating the situation. Workers who struggle with cooperation tend to fear admitting faults or difficulties for fear of reprisal. The connection between employees and leadership significantly impacts how knowledge is conveyed and methods to problem solving are implemented. Current recurring problems and holdups in inpatient treatment have been blamed on lingering disputes amongst healthcare providers. Insufficient interdisciplinary collaboration calls for better use of human resources, especially abilities, knowledge, and competencies. Medical mistakes, a common cause of patient mortality, are caused by new knowledge. Ineffective collaboration results in poor execution of activities. When employees collaborate, they can manage additional tasks, generate innovative ideas, and accomplish tasks on schedule. Utilizing readily available resources reduces implementation expenses. Poor group dynamics have an adverse impact, raising expenses in exchange for delayed deliveries. When communication between teams is not clear or timely, it can lead to misunderstandings, errors, and delays in decision-making. This can result in the misallocation of resources, leading to inefficient management. Patient discontent, incorrect diagnosis, postponed therapy, prescription mistakes, and harm or death resulting from poor communication lead to an organization spending more to counter these problems. A dearth of collaboration and higher mistake instances within the medical sector leads to executives allocating additional funds to resolving issues. The absence of open dialogue and teamwork among workers results in irresponsible use of corporate resources because no one admits their mistakes. The medical field must swiftly embrace the principles of teamwork, solid management, and concise communication to increase the standard of care offered to patients and the efficiency and safety of healthcare employees. Effective leadership tactics for enhancing an interdisciplinary team's capacity to accomplish its objectives. Leadership has a significant influence on organizational cultures and the daily activities of its employees. Transformational leaders are critical for impacting a company's employees, mindsets, principles, and objectives. Successful leaders features abilities and dispositions involve the ability to provide obstacles, convey a vision, and lead by action. They provide personnel a say regarding judgments and encourage people to function to their total capacity. A transformative medical care leader can see the outcome, assess the present condition of things, and understand the advantages of operations improvement. Transformational leadership is vital for increasing patient safety, facilitating an equitable relationship between employee resources and work requirements, and establishing a strong patient safety culture within medical facilities. They recognize the importance of collaboration when seeking task accomplishment. The leadership style greatly influences staff satisfaction and inventiveness, which increases efficiency and assists individuals to obtain their objectives. Executives who may revolutionize a company remain on the front line of addressing current and future issues via collaboration and new ideas. They recognize the need to incorporate advice from other employees to make the best knowledgeable decisions possible. Transformational leaders build connections to improve confidence inside an institution. They are committed to implementing their words within the multidisciplinary cooperation, which drives the team forward. Every team member will have a sense of belonging and tremendous delight in contributing to the project's accomplishment. Transformational leadership may help shape the impact of perceived responsibility on workers' thinking and their conduct. Interprofessional collaboration approaches to assist a team in accomplishing its goals and working more successfully collaboratively. Healthcare personnel from different positions and patients need to collaborate to attain optimal outcomes. Employees at all levels collaborate to maximize their capacities and expertise. When healthcare workers collaborate, they improve outcomes and treatment, they minimize mistakes, increase efficiency, and promote enthusiasm. Transparent communication helps people achieve their objectives and work collaboratively as a cohesive unit. One of the first steps in interprofessional collaboration is establishing clear and measurable goals that all team members agree upon. It is also essential to define each team member's role and responsibilities based on their expertise, skills, and experience. This aids in avoiding confusion, duplication of effort, and conflict over tasks and priorities. Each team member is capable of communicating information to coworkers. Communicating ideas vocally, non-verbally, and in written form is critical. To gather the required data for enhanced medical care, it is critical to maintaining open contact channels with clients and their relatives. It motivates people to rise and contribute to the group's success. Joint leadership improves utilization of existing human resources by allowing people to take responsibility for their respective fields of expertise. Responding to, being attentive, obtaining, and exchanging information with teammates are all aspects of communication that foster practical cooperation. As every participant of an interdisciplinary group has unique expertise and experience vital to reaching knowledgeable judgments regarding patient care, every team member must discover the most effective ways of exchanging pertinent knowledge and expertise with the whole team. The team's dedication towards common goals will be rewarded, and they can communicate successfully.